Hello, good afternoon. Dr. Trudy Ufondu of Snowspirations Global Health Solutions. Thank you and welcome to our weekend open clinic with Dr. Trudy on YouTube. If today is the first day of attending my clinic, thank you so much. I truly appreciate you. Thank you for sharing your few minutes with me. Very quickly, please announce your name, announce your location so we can identify and see how we can catch up with you. This afternoon, we're going to talk about tubal blockage, fallopian tube blockage, and how we can defeat this blockage to help you to become pregnant, and not just becoming pregnant, becoming a mother. Remember that the ultimate aim of pregnancy is not just to answer pregnant, is to have your baby in your hands. So what I'm going to try to help us understand in a few minutes, it's the mechanisms that will stop you from naturally achieving pregnancy, what you can do, what you need to understand, the steps you need to take. My aim is to help you with steps. It won't make sense to tell you about the problems without showing you the steps. So very important. My admin is in full attendance. So my first presentation is going to be on this, the first few minutes. Afterwards, we're going to have a question and answer session. So keep your questions. When I'm done, you will have opportunity to ask all your questions. If you are currently going through tubal factor infertility, you can get help today. You can understand your situation better, then you can take your bold steps. And I'm going to start. You see, the female reproductive system is a very unique system. Everything must work perfectly for pregnancy to occur. How can pregnancy happen? What is the role of your tube? You see, every woman has two tubes, left tube, right tube. Your tube is meant to connect the eggs, which will be released from the ovaries. Every month, a woman will release one egg. When that egg is released, you can see this part of the tube has some finger-like projections. These finger-like projections will receive the egg, which got released, to enter the tube. Now, that's number one part of the equation. The second part of the equation, during sexual intercourse, your partner will ejaculate. So ejaculation means releasing the semen. Semen is what you can see with your eyes. You cannot see sperm. Inside the semen, you have the sperm. When your partner releases the semen will pass through the vagina, pass through the cervix, get to the womb. When it gets to the womb, the sperm will swim and enter this side of the tube. So this side of the tube is called side of the tube is called the proximal part of the tube. This is the distal part of the womb of the tube. So distal means kind of far away. Proximal means together, closer. So the sperm will enter through here. The eggs will enter through here. They will meet in a special place called the ampulla. If everything goes okay, the egg and the sperm will unite to form an embryo. This is the number one most important role of your tube. Thankfully, you have two tubes. Anytime you have two complementary parts of the body, they compensate. So if anything happens to this part of my eyes, this eye can even double in the role. So if you have problems with this part of the tube and it's completely cut off or is completely damaged, but we still have eggs in this ovary, can the woman become pregnant? 100%, including having multiple pregnancy. How? So long as the remaining part of the tube is open and healthy, this part of the ovary can release the eggs, and the eggs can float and go to this side and enter, and the sperm can come in, and you can become pregnant. So when you talk about tubal factor, it must be fully defined. What type of blockage do you have? Which part of the tube is blocked? What is the extent of the blockage? So some women can have mild blockage, some women can have moderate blockage, and some women can have complete blockage. Now, if you have bilateral mild blockage, you can still become pregnant simply by going for HSG, hysterosalpingogram. Hysterosalpingogram is a procedure that will tell us the state of your tubes. So when you are going for hysterosalpingogram, we will pass a special catheter through the vagina and use fluid. When we do that, if you have mild blockage, it's gonna open your tube. So some women might have mild blockage. When they go for their HSG, the HSG can force the mild blockage open and they can become pregnant naturally. Some other women might have moderate blockage. When you have moderate blockage, depending on the extent, depending on the diagnostic criteria, you might be able to open the mild blockage or the moderate blockage by going for micro-invasive laparoscopic surgery to correct those blockages, those scar tissues, those adhesions inside the tube. If this is your situation and you live in an environment that has the facility, you can go for this surgery and that tube that is moderately blocked can be opened. Some women might benefit from hydrotubation. Hydrotubation simply means flushing. But if you have completely or severely blocked tube, and if it's both tubes, so if you have what we call bilateral tubal blockage, bilateral tubal occlusion, it means they are bilaterally damaged. That means the two tubes are damaged, blocked, occluded, not functional, not healthy. When you go for your HSG, when you look at the report, if your two tubes are blocked, the report will say bilaterally non-patent tube. Patency means open. When you see non-patent, it means they are blocked. If you are blessed, if you are favored, and only one side is blocked and the other side is open, you can still become pregnant, including having your multiple pregnancy. Now listen to me carefully. For us to arrive at tubal blockage, we have to know the presentation. So how do you know you have tubal blockage? Unfortunately, majority of women will not show any symptoms. But the ones that will show symptoms, they might have mild pain on that side of the tube. Why are they having mild pain? Because when your tubes are constricted or when your tubes are blocked, they can accumulate fluid. And when they accumulate fluid, whenever you have such setting, you can have inflammation. What are the factors that can likely lead to tubal blockage? Number one factor is pelvic inflammatory disease. If you have poorly treated gonorrhea or poorly treated chlamydia and or untreated or undiagnosed gonorrhea or chlamydia, they can damage your tubes. When they damage your tubes, you will create adhesions, you will create scar tissues, and you will not be able to achieve pregnancy. Now, some other women might have humongous fibroids, which can ordinarily block the tube. Some women might have endometriosis. When you have endometriosis, it means that part of the endometrium, which should only be limited in the womb, is seen somewhere else. So if you have endometriosis of the tubes, that means part of the endometrium is deposited in the tubes, they will block your tube. Now, there are a couple of other ancillary things that can also lead to tubal blockage, including your IUD. If you're using intrauterine device and you have multiple sexual partners, we have noticed that when you have such setting, they can predispose you to tubal blockage. So assuming you have been diagnosed of tubal blockage, both unilateral or bilateral, the question becomes, what are you gonna do? Can you still become pregnant naturally when one tube is blocked? What's the answer? 100%. So we need to know the extent. So it's not just enough to show up and say, hey, doc, my tubes are blocked. I want to know how many of it. Is it one tube? Is it both tubes? Is it moderately blocked? Is it mildly blocked? Is it severely blocked? When you give us full details, your management will be based on what the details are. So if you have mild blockage, I can simply send you for HSG, and HSG can simply open your tubes. If you have moderate blockage, then you might be a candidate for hydrotubation or microinvasive surgery to correct those blockages. But if you have completely blocked tubes, when you go for your HSG, when we pass that fluid, it's going to spill over. So if it spills over, it means there is a blockage somewhere. So it's important to understand this. Now, when your two tubes are blocked, can you still become pregnant? Can you still be a mother? 100%. What do you need to do? We need to understand your situation. If your tubes are blocked beyond surgical correction, what are we going to do? We are going to forgo your tubes and we go for IVF. The role of your tube is to create the mechanical bridge to bring the eggs, to bring the sperm, to unite them together, then begin the downward journey to implant in the womb. So if mechanically the bridge is damaged, can you still get to the other side of your destination? Yes. What do you need? IVF. So if you are in our community today, and for some reasons you are having challenges of tubal blockage, and it happens to be both sides, don't waste your money. Don't waste your time going for things that will not help you. What you need, accept your situation. So there are basic steps I want you to take if you are having tubal blockage. Number one, you have to understand what tubal blockage is all about. You have to understand the role of the tube. You have to understand the relevance. You have to understand the factors that can lead to the damage. Then you have to understand your own unique tubal blockage. By the time we are done doing this, then you must make an appointment with a fertility specialist immediately. Especially if you are older than 35. You do not have the liberty of wasting time. Do you know why? There are so many processes that will lead to pregnancy. Tubal blockage is just one of them. By the time we are done with the tubal blockage, we have to talk about the hormones. We have to talk about the man. We have to talk about the structural setup. So everything must be in tandem. So we can correct your tubes and your partner's sperm is not good. We can correct your tubes and you have hormonal imbalance. So correcting your tube is just one part of the equation. But once it's confirmed that your tubes are fully blocked by any means, and it's confirmed, my sister, my brother, we don't have the liberty of wasting time. We have to take actions immediately. So what's my conclusion before I start taking questions? Despite having tubal blockage, depending on your own unique presentation, we can overcome it. Couple of steps. We can overcome it by sending you for HSG, hysterosalpingogram, and your mind blockage can be unblocked and you can become pregnant naturally. We can overcome it by sending you for laparoscopic surgery to remove the moderate blockage, and we create an opening for you to become pregnant. We can overcome it by accepting our situation, by accepting our option, and start planning for IVF early. Now, there are some dangers in having partially blocked tubes. Some women can have bilaterally partially blocked tubes. It's dangerous. Do you know why? The eggs can come in, the sperm can come in, but there is partial obstruction. So when you end up making the embryo will prefer to start developing in the tubes. When this happens, you have ectopic pregnancy. Ectopic pregnancy is a very deadly emergency that must be stopped immediately. Anytime we notice that pregnancy is not developing in the womb, is developing elsewhere, we have to identify that pregnancy and we have to stop that pregnancy. So unfortunately, some women can have ectopic pregnancy and it's discovered late, and we have to cut off that too through the process of salpingectomy. When we go for salpingectomy, what are we going to do? We are going to cut off that tube completely. When we cut off the tube, do we have alternatives? Yes, the other one is still existing. But some women, unfortunately, might have bilaterally ectopic pregnancy. So if you have ectopic pregnancy once, the possibility of having another ectopic pregnancy is very high. If that's your situation and you end up losing your two tubes, can you still become a mother with loss of your two tubes? 100%. Can you still have all your 5 babies with no tubes? 100%. Unfortunately, some women are born with both tubes missing. Some women are born with one tube missing. One is there. What we need to succeed in becoming pregnant is one tube. What we need to succeed in becoming pregnant is one ovary. If you have one functional ovary, if you have one functional tube, that one functional ovary can give us eggs. That one functional tube can receive the eggs, receive the sperm, then go back and implant in the womb. So the criteria for a woman to become pregnant, despite having tubal factor, is at least one healthy ovary and one healthy open tube. So long as you have this, you can defeat infertility, you can become pregnant, and you can become a mother. Okay, so I'm going to open the clinic now, and I want us to start asking our questions in real time. So the clinic is open. Please feel free and ask your questions in real time. We have about 15 minutes to provide you feedback. Please go ahead. And if you need any help, please, my admin is also in attendance. Remember, tomorrow we have a very big event. If you want to participate, you better register before the deadline. Gender Selection Family Balancing Symposium. If you miss this, you missed something huge. If you have always wanted to have a baby boy, if you have always wanted to have a baby girl, but you have not succeeded, and there is absolutely nothing wrong in wanting to have a baby boy, absolutely nothing wrong in wanting to have a baby girl, but the question is, how do you go about it? If you want to gather superior knowledge about this, meet us halfway tomorrow, 9 p.m. Nigerian time, and we're going to gather, and we're going to learn, and we're going to begin the journey of balancing our family. It's okay to balance your family. There is nothing wrong with it. But people like us, we don't care if we have boys. We don't care if we have girls. We are okay that we have kids. But if your peace is threatened because you don't have a particular gender, come, let's fellowship tomorrow. But right now, let's talk about the questions, okay? Thanks for all you do. Is it possible for both tubes to be blocked at the same time? Yes. Unfortunately, it can happen. So some women can have bilaterally blocked tubes. If that's your situation, we need to know the extent of blockage. We need to know the location. Remember, we have the distal part of the tube, then we have the proximal part of the tube. If both sides are blocked, if bilaterally this tube is completely blocked, this tube is completely blocked, can you still get pregnant? Yes. What do we need? IVF. But if one side is blocked and this side is open, you can release your eggs from this side of the ovary, and the eggs you release here can fly and enter through here. Beauty of God. Okay, guys, keep asking your questions. I want everybody in attendance to ask questions. Please, admin, remember to shortlist Tosi or Padiran. I want her to attend the event tomorrow. So Tosi, remember to send email to admin so admin can send you the link to attend. You've been faithful. You've been regular, and I appreciate people like you. Thank you so much for your support. Okay, let's continue with your questions. Can endometriosis and adenomyosis damage fallopian tubes? The answer is yes, especially endometriosis. So what's endometriosis? When you have endometriosis, some parts of your endometrium, which are the cells that should only be limited inside your womb, are seen elsewhere. So when you have extensive endometriosis, it means you might have some endometrial cells inside your tubes, damaging your tubes. What's the problem with endometriosis? It causes a lot of very severe pain. So if you have endometrial cells inside the tube, what will happen when you start bleeding every month? They will start bleeding. Unfortunately, your tubes are not structured in such a way to handle bleeding. So anywhere you see endometrial cells, they can cause problems. So when you cannot bleed out in the tube, what will happen? That blood will collect there. That blood will start forming inflammatory focus. That blood will start forming scar tissues. And lo and behold, your tubes will be blocked. So endometriosis can be a factor in tubal blockage, in tubal damage. And adenomyosis is a different bottle of fish. In adenomyosis, for some reasons, the endometrial cells, which ordinarily should be limited to the cover of your womb, will start encroaching into the muscular layer of your womb. So adenomyosis might not directly lead to tubal blockage, but endometriosis can directly lead to tubal blockage. Okay? I love that question. Very, very cool question. Now, explain hydrosalpinx. So hydrosalpinx is also another situation that can damage your tubes. Now, when you have hydrosalpinx, it means that the lumen, that's the opening of your tubes, are shrunken because your tubes are now swollen. So your tubes accumulated a lot of fluids. So ordinarily, when you have a lot of fluid in the body, it will narrow the lumen. So when you have hydrosalpinx, it means that the tubes are swollen because there is fluid accumulation in the tubes. And when that happens, it will narrow the normal big opening of the tube. And when that happens, the eggs cannot come in, the sperm cannot come in, and you begin to have tubal blockage. So hydrosalpinx is also a factor that can damage your tubes. If you have bilaterally hydrosalpinx damaged tubes, it means that there is fluid accumulation in the two tubes and they have affected the function of your tubes. So yes, hydrosalpinx is a factor that can lead to tubal blockage. Can a woman with blocked fallopian tubes have period? 100%. Whether your tubes are blocked or not, so long as the factors that favor bleeding are active, you can bleed. Let me explain. Why do you bleed if you're in an ovulatory cycle? So once your hormones, your reproductive hormones are within normal range, estrogen, progesterone, FSH, LH, the body will start receiving signals every month. So the reason why women bleed, if they are still in their reproductive phase of life, is because of failure of pregnancy to happen. Every month, as at the time the ovaries are releasing the eggs, the body will start changing, the hormones will start changing, they will start increasing the production of progesterone. Progesterone is the pregnancy maintaining hormone. When you start releasing a lot of progesterone and the eggs are released and the sperm is coming in, the womb cover is getting ready to receive that pregnancy. But when pregnancy fails, the womb cover will shed off, will break down, and it will pass out as your menses. So whether your tubes are blocked or not, it doesn't concern the hormones. The hormones will still work on the cover of your womb to bleed. So majority of women who might have tubal blockage might still be bleeding. But the fact you're bleeding doesn't give you the automatic qualification to become pregnant, because some women might be bleeding, but they are not ovulating. And some women might be bleeding, but their tubes are blocked. So your tubal blockage is independent of your bleeding mechanisms. So long as you haven't gone into menopause and your hormones are within normal range, you will bleed. But the fact you're bleeding doesn't preclude the fact that you will become pregnant. You might be bleeding, it might be anovulatory bleeding, it might be anovulatory cycle. So anovulatory cycle means you are not releasing eggs. The criteria that will get you pregnant in any situation is the release of your eggs and the availability of the sperm. Once you have the eggs and you have the sperm and they come together and they form an embryo, you can become pregnant. But when you don't have an eggs, you cannot achieve pregnancy. No eggs, no pregnancy. No sperm, no pregnancy. We need both of them to come together for pregnancy to happen. I love that question. Okay. What do you advise in general for blocked fallopian tubes? Surgery first or straight to IVF? What I personally advise is to gather the knowledge. So you need to improve your CAP, knowledge, attitude, and perception. So we need to define your own tubal health. Is it mild blockage? Is it moderate blockage? What's the extent? What is the stage? Now, by the time we know your full diagnosis, then your management might differ. So personally, what I want you to do is to hook yourself up to a fertility specialist. A fertility specialist can determine the exact diagnosis you have. So assuming you have mild blockage, are we going to do any magic? No. We will just send you for HSG. So most women that go for HSG can actually improve their fertility, because if you're going for HSG, HSG can open your tubes if they are mild. If you have moderate blockage, then you might go for hydrotubation or surgery. So IVF is never the first option. IVF can only come forth by the time we have determined that your two tubes are beyond repair, you don't have availability of surgery. Then when that situation comes and the two tubes are blocked, then you must go for IVF. So IVF is never the first option, even in fertility management. IVF only comes in when other methods of fertility management fails. So IVF is always the last, okay? All right. Okay, what's the role of fallopian tubes in achieving pregnancy? Very important question. So your tubes are the mechanical bridge that connects the egg, which will be released from the ovaries, and the sperm, which will come in through this way. When they release the egg, and the eggs come into the fallopian tube in a special place called the ampulla, and when the sperm is available, both of them will unite to form an embryo. When embryo is formed, the cover of the womb is already increased the production of progesterone. The ovaries are producing progesterone, so the womb will be ready. Progesterone and estrogen will prime the womb to receive the pregnancy. The process of receiving the pregnancy is what we call implantation bleeding. So the role of your tubes are in three folds: receiving the eggs, receiving the sperm, getting them together, then transporting them back into the womb. This is the natural role of your tube or your tubes. If you lose this natural role, what are we gonna do? We will forget your tubes entirely. We only concentrate on getting the eggs, getting the sperm, and getting you pregnant with assisted reproductive technique. So your tubes are mechanical bridge. So if this part of the tube is damaged, but this side is good, you can still become pregnant naturally. So the role of the tube is to provide that natural ability for you to become pregnant. But if it's damaged, then you need to become pregnant through artificial assistance, through the process of IVF. Okay? All right, let's continue, guys. Okay. For the presentation, can the body weight of a woman lead to tubal blockage? Not directly. They are not directly correlated. Your BMI, your body weight does not preclude tubal blockage. But if you have other lifestyle issues, multiple sexual partner, you pick gonorrhea, you pick chlamydia, big fibroid, you didn't treat it, endometriosis, PID, pelvic infections, all this stuff can combine together to affect the integrity of your tube. But your body weight, your BMI, they do not have a direct correlation with your tubal blockage. I love that question. Very technical. Okay? Are there things you can do to ensure you maintain the health of your fallopian tubes? I love this question. This is actually the reason why we started this group. Acquiring the right knowledge, knowing the role of your tubes, knowing the risk factors. So what are the risk factors? Multiple sexual partners can easily predispose you to picking up gonorrhea, picking up chlamydia. When you have gonorrhea and chlamydia, if we don't pick it up early or if you don't treat it properly, they can graduate and cause pelvic inflammatory disease. They can damage your tubes without you even knowing. Why? Because most women that have tubal blockage will not know until they start planning to become pregnant. So most women will not have symptoms. So being aware, being sexually aware, adopting very healthy sexual lifestyle, modifying your health. If you have any issues, you deal with them. If you have the fibroid, you remove them. If you have endometriosis, you go for treatment. So all those things that might likely lead to blocking your tubes, when you have the foreknowledge, when you have good attitude, when you have good practices, when you have good presentation, then you can forestall it. So you can have increased awareness of your tubal health, and you can plan and adopt those healthy lifestyle that will give you an opportunity. Unfortunately, some women can observe all the healthy preventative lifestyle and they will still have tubal blockage by default. Okay? All right, but I love those questions. Is there anything like tubal flushing? That's called hydrotubation. Yes, there is something called hydrotubation or tubal flushing. But guess what? It's not in all tubal blockages you go for this. If you have mild blockage, you can go for tubal flushing. If you have moderate blockage to an extent, you can go for tubal flushing. So there are different criteria and different procedures for doing this. But if you have severely, completely blocked and damaged tubes, no level of flushing will help you. So flushing is only for mild and moderate tubal blockage. Who will determine what you need? Your gynecologist, your fertility specialist. Some women have been flushing their tubes completely, severely blocked tubes for the past 10 years. You are wasting your time. You could have become a mother 9 years ago. You could have become a mother 8 years ago. How? By forgetting the fact that naturally the role of the tubes have failed, and you present yourself and you go for IVF. You don't gain anything. Having completely blocked tubes, and you have been flushing it for the past 10 years, you are wasting your time. You don't have the liberty to waste your time. You have to act immediately. Okay, let's see what we have. Okay, all right. How soon after HSG can you try to conceive? You don't have any limitation. Once the discomfort of your HSG subsides, keep on making love. Most women that will go for HSG will give them some painkillers. So once the discomfort and pain from HSG subsides and you're not bleeding, you keep on making love. There is no time frame. So there is nothing for you to wait for. The reason why we are asking you to go for your HSG is to know the extent of your tubes. Guess what? Some people might be shopping for IVF money. Some people might be shopping for IUI money, and suddenly they can become pregnant. How? Because that's what God can do. So you need to be in the arena of blessing and present yourself so that God can meet you halfway and you can become pregnant. Okay? So you don't have any time to waste. You're not supposed to wait. Once the pain from that HSG subsides, keep on making love. And you cannot go for your HSG when you're bleeding. And you cannot go for your HSG if you have not confirmed you're pregnant. Unfortunately, some women are not aware. They are going for HSG with a full pregnancy. You cannot go for HSG if you are pregnant, because if you are pregnant and you're going for HSG, what are you doing? You are inadvertently aborting your baby. So before you go for HSG, you must confirm you're not pregnant. Admin, please capture that for me. You must go for HSG when you are not pregnant. If you are pregnant and you're going for anything they will introduce into your vagina, to your cervix, to your womb, you are inadvertently killing your baby. So do not go for HSG if you have a positive pregnancy test. You are not a candidate for HSG. Okay? All right. What causes a pregnant woman to give birth to a baby girl with blocked tubes? My sister, I want to believe you've been following me. Depending on the extent of your blocked tubes. So I've seen women that go to the church and they give their testimony. Oh, they told me I cannot have a baby. My 2 tubes were blocked. And suddenly Jesus Christ came back and opened my tube. What happened in that situation? Yes, Jesus Christ can open your tubes. Jesus Christ can do everything. He's the author and finisher of our faith. But what likely happened in your own situation is that Jesus Christ, through doctors, helped us to send you for HSG. So you had mild blockage. And when you went for your HSG, that fluid opened your tubes, because by default, when you're going for HSG, you're increasing your fertility. So, but you cannot become pregnant, my sister, naturally if you have completely blocked tube. Anybody telling you that is deceiving you. It's not possible. Okay? All right. Does tubal blockage affect something to do with age? Not directly. Not directly. But here's the deal. If you are older and you have a lot of concomitant pathologies, big fibroid, endometriosis, couple of damages, PID, and you are older, then age can come in. But age as an independent factor has nothing to do with your tubes. Okay? Correct. Before you go for HSG, admin, you wrote SHG. It's HSG, hysterosalpingogram. Before you go, of course, a good doctor would have confirmed you're not pregnant. You cannot become pregnant and you're going for HSG. Once pregnancy has happened, then you are not a candidate for HSG. Okay? All right, thank you so much. Now, what we're going to do next is to transition to our Facebook. We have a rally against tomorrow's event. So if you're in our Facebook, I want you to join me in the community page or our main page. We'll confirm so we can have our last minute rally and give you an update on what you need to know, because tomorrow's event is strictly by invitation. But thank you for coming this afternoon. Please seek help early. If you have tubal factor infertility, the earlier you seek help, the better for you. Thank you for coming. I'll see you guys in Facebook. God bless you and bye-bye.